waiting your turn. Many of us have been in the emergency department. For those who does not, here is how it works. You arrive at the registration desk, provide your personal information, and then you send it to the triage room. The triage room is where the nurse takes your vital signs like blood pressure, heart rate, pulse, respiration rate, temperature, pain level, main reason why you're there, among other information. Once triage is complete, the nurse will decide if you require immediate attention or you're stable enough to wait. Our research focuses on those patients who are stable enough to wait, which surprisingly are more than the 75% of the people who visit the emergency department. The idea of this research came from a real experience. A few years ago, one of our closest friends brought her mother to the emergency department, and she was having a terrible headache. After triage, the nurse decided that the patient was stable enough to wait. 15 minutes later, our friend asked the nurse to take another look at her mother. The nurse responded that she was busy with incoming patients and that they have to wait. 25 minutes later, our friend was able to convince the nurse to check on her vitals mothers. Nurse noticed an elevated blood pressure and discovered that the patient was having a heart attack right in front of them. Although the story had a happy ending, we started wondering if this situation was more common than we thought. After doing some research, it was shocking to discover that this type of events have been experienced for many patients, and even worse, discover that there are cases in the United States of patients who die waiting in the emergency department. For those reasons, we decided to investigate this issue further, and finally, after years of persistent research, we presented to you today a promising solution, a system that allows nurses to better monitor the patients that are waiting. You may not know how much information about your health status can be extracted for your vital signs. Our system relies on this data. We're proposing that each patient waiting in the emergency department must wear a non-invasive, portable, and wearable device that measures in real time and continuously vital signs. This information is transferred by Wi-Fi to computer devices like cell phones, laptops, or tablets, where nurses can see at any time any patient's condition. The system will be an immense help in indicating that a patient is in danger, alarm the nurses so they know that immediate care is crucial. We firmly believe it is time to create a change in the emergency department and establish a more proactive triage system. And hopefully one day, with the help of these devices and our system, nobody else is going to die waiting in the emergency department. Thank you.